important website. It says right on the NSDA, National Spasmodic Dysphonic Association. They're entitled to have a front 501c, a nonprofit representing Allegan. I think the world of this organization.
But this fellow by the name of Chip Hanover, who's featured on the video, is a race car driver, apparently, NASCAR driver, real macho sort of guy, and this. And Michael Rolnick, you know, PhD, did I guess he did a video stroboscopy, a phonatory workup on Hanover.
I don't know. He never said that.
Well, he claimed, and I'm talking about Rolnick, that the physicians who perform these Botox injections on patients with SD, they precisely know the location of where to inject, and B, they know exactly the right dosage, precise scientific dosage.
And you don't believe that?
No, I don't know. I'm asking you. You're the one who's had the experience with the patients. Did Tim Kidwell report that he had A, the precise location injected, and B, the precise dosage?
Do you know what hype is, and hoopla, and PR? Medical people and the Allegan people, the makers of Botox, are entitled to their view, which they present through this 15-minute flick. But reality is something else. I think they do a very good job of telling the public and the media and the patients what they want the public, the media, and the SD patients to believe. It's just not real, from my experience, clinically speaking. They don't know the dosage. And if you start asking the ear, nose, and throat doctors, Peek Wu is one of the top people. He's experimenting. Botox is an experimental drug. It is not approved by the FDA, the Food Drug Administration. It is never.
Well, it's approved for some things. It's not approved for treating spasmodic dysphonia.
No, it's an orphan or off-label drug because they can use it for eye spasms and neck spasms. But something that the makers of Botox don't want to consider or face is that the eye spasms and the neck spasms may be coming from the misuse of the voice, which is creating strangled voice, spasmodic dysphonia. And why are they afraid of cures? Because cures of this condition then say they're doing something to the human body that may not be relevant or applicable or appropriate. And I'm saying, from my experience, my clinical experience, they're on the wrong road in treating this condition. They've never had a single cure with Botox, and they say there are no cures by Botox or by surgery, and I've been reporting ongoing cures for 35 years. So why would they be concerned about cures of the strangled voice? Because it brings down the whole medical edifice and the drug field.
Well, there's a couple interesting tidbits, I think. We had a young man here who was a minister. I think he was a Baptist preacher. His name was Tim Kidwell, and he said that the experience was not simply a bee sting of having this Botox injection, but rather it was quite an ordeal for him.
He is not alone.
A traumatic event. He said, number one, that it was not precisely dosed. That the doctor asked Kidwell, "How much do you want me to give you?" which he found to be very odd. It was very upsetting to him. I remember talking to him about this. And number two, that the Botox started leaking down into his esophagus, paralyzing his ability.
That is not isolated.
He developed dysphagia, which meant he was like choking on his own saliva. He couldn't swallow easily. So what I find interesting about the Botox game, if it is a game, as far as the way it's marketed or presented through the NSDA and others, is that it's all based on science. But from what Kidwell described, what goes on the table, when you get into that table and they start putting the needles in your throat, what happens to the science?
It's not a bee sting. It's traumatic, and the dosage is not specific. And
but what happens to the science? The science goes out the window.
Who said there is a science? The medical people are saying this is the state of the art and treatment of choice, but Rolnick is representing a point of view. He's entitled to his point of view, but there's another point of view, which is reality, and that's what I'm saying. And saying, with the experience of 35 years in this field, treating SD, and the only doctor in the world reporting cures of it is on my website, and being in the field for 45 years, 8 of those years at UCLA Medical Center, and the staff and faculty and running the voice and speech clinic and breaking open all kinds of voice problems and hopeless voices, that this is a view that is sold to the American public that voice problems, not only spasmodic dysphonia, but bad and raspy voices, and there are a huge number of these cases in this country. They talk like this. Now, the spasmodic dysphonia, the strangled voice, talks like this. I thought maybe. You can see the neck muscles, you can see the eye spasms, and you can hear the voice, and it's terrifying. But the medical community wants to make it a medical problem. From 1871, Traub described it as nervous hoarseness. They never had a single cure treating it psychiatrically. 1960, they came up with a study, Rowe, Brumlick, and Moore, suggesting it might be a neurological problem, not conclusive, and making it from there on in a neurological problem without the foundation of documented evidence that it is. Now, the medical people insist at their medical meetings and their medical journals that spasmodic dysphonia is hopeless, incurable, and they're giving 4 to 10 Botox shots a year, or more each and every year for $1,000, $2,000, or $3,000 perhaps, a shot. Now, this is a full employment act for those who do it.
Well, this is botulinum toxin type A. This is the same
full
drug, by the way, that you see advertised
a lifetime annuity. Yeah.
This is the same drug that I've seen advertised, Botox parties, in the LA Times and elsewhere, for $150 a shot. So why is it that your profession winds up charging?
What are you saying? It's my profession.
Well, I mean, the voice field.
The medical. What are you saying? The voice field. Okay. My field doesn't do it.
Okay, the medical voice
field does it.
They charge up to $3,000 a shot.
Apparently, they feel they warrant
the operating room costs, or what factors
because
into this?
they feel they're more sophisticated than dermatologists doing the Botox for the face.
Well, I understand.
You always put down the people at the highest level, and the nose and throat doctors.
Well, you find them to be, very competent, skillful surgeons and humanitarians.
They, to a person, I would say, humanitarian, well-intentioned, and compassionate. On the wrong road, entirely with spasmodic dysphonia.
All right, they're barking up the wrong tree. They're not really changing voices. But then again,
they're changing voices because when you get a Botox shot, you get a roller coaster ride. You've never seen this roller coaster ride. You ought to try it
once. You get a Botox voice.
You get a Botox voice.
Now, a Botox voice isn't a very natural-sounding voice, is it?
I'm talking like that.
It's a very breathy sound at first, and then it starts strangling again. But there is a window in there.
Yeah.
I understand if no one really knows the exact length of the window.
Iffy.
It could be a minute, it could be 5 minutes, it could be a week, a month,
6 months,
where the patient gets their voice back.
Gerald Burke at UCLA, a head and neck division chairman, has written in December of 1999 in the National Spasmodic Dysphonic newsletter that there are serious outcomes of it, and you need the shot 4 to 10 times a year, I believe, is what he wrote. So
do they ever expect to graduate the medical approach to treating spasmodic dysphonia with Botox? Do they ever expect that at a certain point there will no longer be any further need for Botox because the neurological condition that they're assuming causes the spasms or the spasmodic dysphonia will actually be cured? Yeah,
well, the cure is not a cure. One of the patients at the Mayo Clinic had 40 Botox shots over 8 years. She had no voice at all. I got her voice back. She stayed with me in direct voice rehabilitation, and she was shocked. So was her husband. Another young lady came in. She had 45 Botox shots, 45 over 15 years, and she was hopeless. There was no voice, none. They paralyzed the vocal.
That's 3 shots a year.
Yeah.
What's wrong with that?
Another young man who was on this program, Ron Steger, who works for a national organization, had 5 Botox shots by his ear, nose, and throat doctor. None took, and he needed his voice. His doctor gave him my name and said, Cooper has cures. He has his voice back. He's been cured. It's interesting to ask the audience and yourself, and the question we pose, why is the medical profession so afraid of cures of spasmodic dysphonia? Because it brings the whole house down on it.
Do you think it turns the paradigm on its head?
They have the wrong role model. They have the wrong paradigm.
So you think it turns the paradigm on its head, basically? It says the paradigm is wrong.
Yes. And
it sort of shakes the foundation, the whole theory that goes behind administering these shots, which has become like a cottage industry, especially for some who are lucky enough to give these injections.
I would go back to school if I had the time.
I guess you could become a nurse.
No, I would want to give the shots. But the other thing is, you said something which is very apropos. It turns the field on its head. That's literally what I'm doing.
That's what I'm talking about.
Yeah.
But maybe that's why they don't like you talking about these things.
Why don't you explain what I'm doing? I'm turning the voice from the lowest throat where all strangled voices are. All strangled voices are down here talking like that. And it makes your eyes pop out, gives you eye spasms, it gives you neck spasms, back spasms. The medical profession, my colleagues, I know them very well. UCLA, I knew them, I worked with them, got along famously. I came up with cures later on when I went into private practice, and it's not what the medical community has in mind. I'm turning the voices up to the face, where all good and great voices are in the mask, away from the lower throat by pitching the voice. Pitch. It's a very simple modality. It's so simple, it's mind-boggling.
Most people don't want an elevated pitch. They want the lower pitch. Look,
I bring the pitch down, I bring the pitch up.
Don Corleone, I remember Marlon Brando. He played it in Godfather. You remember Marlon? Yeah. Well, it was like a spasmodic, dysphonic voice he used.
But that's a bad, raspy voice.
That was
coming from the lower throat.
A voice of credibility, of authority.
No, it's not a credibility.
Then why did Corleone?
We have George W. Bush, he has authority.
Don.
We have Bill Clinton. The rasp. But that's they felt the women felt compassionate toward Bill Clinton. He had that rasp. He was admired for the rasp. But we misuse our voice culturally so extensively, it's mind-boggling. The medical community is not trained to understand that our failing voices, nodules, polyps, contact ulcers, premalignancies, papillomatosis, leukoplakia, and keratosis, when it's not smoking related, broad vocal cords, and unilateral cord paralysis, not caused by surgery or cut in the recurrent laryngeal nerve, that essentially nearly all voice problems are due to misuse of the speaking voice or the singing voice.
Okay. What you're bringing up is an interesting dichotomy, as it were, which is the medical worldview, medical paradigm. And your paradigm, you're saying that the voices can be retrained. You're saying that people can change the way they speak, and they can get out of this deep throat sort of talking, get to a point where they can actually have clear and powerful voices through a little bit of exercise and training.
I'm not saying that. I'm documenting. I have peer-reviewed for what I'm saying. I've gone the whole route. The protocol is to peer review, have your stuff published. I've been published in medical journals, in academic journals. I've been honored by the American Speech and Hearing Association for breaking open all these voice problems we're talking about. It's an interesting field that I'm in, but it's changed in the last 25 years to medicalization.
Like you say the word, it's interesting. I mean, what I'm hearing you say is it's exasperating, it's frustrating, it's maddening. This is madness. These people are on the wrong road. They are ejecting people, operating on people. Why don't they get with the program and say, look, you can retrain the voice?
They would be out of practice in a sense. They're doing surgery.
No, but this is let's be honest with patients. Let's be upfront. Let's get the real information out there. Let people make a choice.
They are trained to do medical treatments. That's what they do. That's what they're going to do, and that's the way it's going to be. But there was a statement in Voltaire's Candide, and you know who Dr. Pangloss was?
Yeah.
What did Dr. Pangloss said?
I think Dr. Pangloss, he said that this is the best of all possible worlds.
Where was he in front? Of dismembered bodies, heads, and so forth, standing in front. Is this not the best of all possible worlds?
Well, you're not saying that the medical profession is murdering people.
No, but he's saying this is the best of all possible worlds. So if there are these problems with the medicalization, that's the way life is, and that's where we're at. Dr. Curtis, we've run out of time. Thank you very much. What's the title of the program? Who's afraid
of strangled voices or something? Cures.
Okay.
That's it.
Thank you very much. Bye-bye.
Look, you think it's an economic issue, but maybe they're just embarrassed. Maybe it's just turning the profession on its head. Think about what I'm saying. You're putting the voice up in the mask, which is turning the voice on its head. They're saying that, look, this is a neurological problem. They have evidence. They have scientific proof for this back in 1960. And you're saying that 10 subjects wasn't enough.
They can't find it. They've never been able to document the fact it's a basal ganglia problem.
I asked
a brain problem.
Look, Donald McNeil. I asked Donald McNeil Jr. at the New York Times, what was the source of this information that Botox is giving